Medical considerations before performing hijama. Welcome back. In this section, we will explore important medical considerations to keep in mind before performing hijama. If you are uncertain about a client's medical condition, advise them to consult their doctor to determine whether hijama is safe for them. When in doubt, it's always best to refrain from proceeding. Cupping on children. In the UK, performing hijama on children under the age of 16 is considered child abuse. Therefore, it is strictly prohibited. Strenuous activity. Hijama should not be performed on individuals who will be engaging in strenuous activity, such as air travel or sports within 24 hours. While 24 hours is generally the recommended waiting period, it is advisable to take additional precautions before resuming such activities. Pregnancy and postpartum considerations. Can pregnant women undergo hijama? No. Hijama during pregnancy can lead to miscarriage or premature labor, so it must be avoided. How long should a woman wait after childbirth before having hijama? A minimum of 40 days. Can breastfeeding women have hijama? Yes, in some cases it can be beneficial, particularly for conditions like mastitis, where milk ducts become blocked. Hijama during menstruation. Women can have hijama whilst on their menses. There are no Islamic or medical restrictions against it. Areas to avoid. Certain areas of the body should never be cupped, including veins. Never cup directly over veins. Swollen lymph nodes found around the neck, armpits, groin, mans, and behind the knees. Inner elbows, wrists, and knees. These areas should be avoided. Private parts. Hijama should never be performed in these areas. Face and sensitive areas. This includes the eyes, nose, lips, ears, armpits, and throat. Additionally, if a client has a major illness or appears frail, hijama should not be performed. Serious medical conditions to be aware of. Hijama should not be performed on individuals with severe or terminal illness, including organ failure, tuberculosis, hepatitis, HIV, AIDS, Ebola, late-stage cancer, frequent dialysis more than twice a year, meningitis, severe dementia, any other terminal illness. For anyone with a medical condition or taking prescribed medication, hijama should only be done with the explicit approval of a medical professional. However, for those seeking hijama for general health and preventative care, it remains a beneficial practice. Heart conditions and blood thinners. If a client on medication, the therapist must determine whether hijama is safe for them. Anticoagulants, commonly referred to as blood thinners, prevent blood from clotting, which can increase the risk of excessive bleeding after hijama. While these medications do not make the blood thinner, they reduce clot formation, which is essential for preventing conditions like strokes and heart attack. Common anticoagulants include warfarin, heparin, Maravin, Coumadin, other prescribed blood thinners, etc., etc. Before performing hijama, always check the client's medication labels or research their prescription to ensure safety. During the consultation, inquire about any blood thinning medication to prevent complications. By understanding these medical considerations, you can ensure that hijama is performed safely and responsibly, prioritizing the well-being of your clients.